Surface palpation of the cervical spine.
So the first thing you want to do is just make sure that the patient's in a neutral position for the cervical spine. So if they need a pillow or more or less towels, you just kind of want to see this vertical line going through the tragus. So in the facial plane, kind of horizontal to the table. So he looks pretty good in that position. So we can start down here and just kind of feel the sternal notch, and then we'll kind of just go along the clavicles, feeling for any increase in fluid accumulation or fullness in the supraclavicular notch. And then we can palpate along the sternocleidomastoid. So you can kind of touch at the clavicles here, and then palpate kind of with your thumb all along the sternocleidomastoid from the clavicle all the way to the mastoid, feeling for tenderness, fibrosis, reproduction of symptoms. You can kind of take the muscle and see how mobile it is, front to back, all the way up. And we do that on both sides. So palpate here, a little more fibrotic on this side compared to the left, comparing side to side all the way to the top. All right. Now, you can feel the larynx to just see how supple and mobile it is, and you'll have a little clicking there. Your cricoid cartilage will click a little bit, and that's normal. You don't do this on every patient, but I want you to feel how you can drop your finger into the groove along the sternocleidomastoid in between the larynx, and you'll come to a hard tissue, which is the cervical vertebra, and you can feel it on yourself. And if you run up and down, you're actually going to feel a little bump, and that's the cervical disc. Okay, you didn't know you could feel that so easily. It's not comfortable. That's why I don't do it with my patients. It doesn't give me any information, but I just want you to know how close that is. Okay. So from that position, we're going to feel while they're in supine. We're going to take our hands to midline at the occipital protuberance. Okay, where the skull comes down. You're going to put your ring finger right on the occipital protuberance. I'm going to turn his head so the camera can see, and fingers right here in the groove. Okay, so ring finger on the occipital protuberance, two fingers, the middle finger and the pointer finger, and at the very edge of your pointer finger, you're going to feel a big bone, and that is the spinous process of C2. Okay, you cannot feel the posterior arch of C1; it's too deep in midline. All right. So you're going to feel the upper part of the spinous process of C2, and then you're going to put your fingers on either side of the spinous process of C2. It is big. It's about that long on some people, okay? It's a big bone on J. So I'm going to feel all the way along that from top to bottom, all the way along the side of the spinous process, on the right side, top to bottom, and all the way along the spinous process on the left side. Okay. And I think that's it.